Good morning. As Dr. Gentile had mentioned, quite a departure from the very clinical programs that you guys were introduced to early in the morning session. So I'm very happy to be here. I'd like to thank Heinz and everyone involved for putting together this symposium and for inviting me as well to talk about this important topic. As you will find, well, these are the things that I hope to talk about today, to inform you about the increasing prevalence of asthma, the local importance of asthma in Pennsylvania and in Allegheny County, the history of asthma and air pollution epidemiology, the impact of air pollution on asthma, and the local impact, finally, of air pollution on asthma. And as it has been alluded to earlier, there are increasing trends over time, and this is a national issue, it's a statewide issue, and it's very much a local issue. Nationally, there's 8%, recent estimates, or 25 million people who have asthma. And this is as compared to 2001 when 5 million fewer, 20 million, or 7% of the population had asthma. And these asthma rates have risen most among black children, which is almost a 50% increase. And this is based on some CDC estimates. Now, locally, over time, and this is adapted from the BRFSS conducted by the Allegheny County Health Department, and this was published just late last year in 2012. And they did a comparison of the 2002 BRFSS compared to the 2009-10 estimates of the population. And you can see that the asthma rates have increased in both black and white individuals, but most pronounced within the black population. Nationally, you can see, as Dr. Gentile had shown, some of the air pollution levels are high in the Northeast Corridor. Asthma is as well. Now, we don't know, as Dr. Piedemonte and others had mentioned, there are many causes of asthma. And air pollution appears to be a contributor, at least to the exacerbations and potentially onset of asthma. But we can see that within Pennsylvania, we have some of the highest rates of the nation, estimated at over 9%. And again, this is the 2010 estimates based upon the BRFSS. And we can see, again, not only as compared to the United States as a whole, but we can see an increase there from the U.S. levels to the Pennsylvania levels and then to the Allegheny County levels. And it's pretty much between the total population and the white population, similar for Pennsylvania and Allegheny County, which is just a pinch higher than the nation as a whole. But when we take a look at the African American population, both in Pennsylvania and in Allegheny County, which is largely driven by the populations of Philadelphia and Pittsburgh, that's where the highest concentration of African Americans live within the state of Pennsylvania, we can see that the asthma rates are really exponentially higher. This is information from the CDC Public Health, Environmental Public Health Tracking Network, to which we're an academic partner. CDC has recognized that particulate matter can cause hospital visits, asthma, adverse birth outcomes, lung cancer, and even early death. I have colleagues in the room who will speak about some of the other outcomes associated with particulate matter, and you can see that younger people and older people, as well as active people, are most at risk. The criteria pollutants of interest, and I borrowed this from one of our fellow Public Health Tracking Network members, John Balms, who works in California. The criteria pollutants are regulated by the National Ambient Air Quality Standards. They include ozone, nitrogen oxides, sulfur oxides, particulate matter, carbon monoxide, and lead. As Dr. Gentile had mentioned, Pittsburgh is one of 2 cities outside of California to rank among the top 25 in ozone pollution, according to the American Lung Association. 7th for short-term particle, 8th for year-round particle pollution, and 24th in ozone. Although the number of unhealthy air days has decreased from 26 days until to 20 days annually. So who cares about air pollution? Yes, it's bad in Pittsburgh because of our industrial legacy. We all recognize that, to be a fact of life when you live around here. The biological mechanisms of exposure to particulate matter, as you can see from this slide, it includes the whole body. But I'm going to specifically talk about the impact on the lung and the impact upon asthma. It's been shown to contribute to the onset of asthma, to exacerbate asthma, as evidenced by emergency department visits and hospitalizations, and contribute to chronic lung disease. So specifically, how does pollution contribute to asthma? With ozone, there is direct oxidation, free radical formation, lipid peroxidation, and a secondary inflammation that occurs within the lung. Now, it's important to note that bad ozone, as we breathe in, the ground level ozone that we all breathe in, is not emitted directly into the air, but it's created by chemical reactions with nitrogen oxides and VOCs in the presence of sunlight. Now, some of the major contributors to these pollutants include industrial facilities and electric generation and motor vehicles as well. So we can recognize that in the Pittsburgh region we have plenty of these sources. Our 8-hour ozone levels have decreased over time. We are out of attainment for ozone. Now, it's interesting to note that ozone is not necessarily a pollutant of the inner city. When we look at downtown Pittsburgh, it's not really an ozone. It's primarily a suburban pollutant, and we have done some cluster analysis to show that. Still, and actually, one important thing to note is that Harrison Township, which has the highest ozone levels, as noted in blue here, is located well outside of the city of Pittsburgh. As far as trends over time, we can see the measure was different until about 2005, I believe, and that was based upon a 1-hour ozone exceedance. And now we measure 8-hour ozone exceedance days. And we were having some real problems with that here in Allegheny County in the mid-90s. And it's been up and down since then. But actually, I failed to mention these graphs are coming from the Allegheny County Health Department air pollution report. So I'd like to thank them. Nitrogen oxides are not as potent an oxidant as ozone, as in they don't exacerbate don't exacerbate asthma as efficiently as an ozone does. However, it does react with water to form nitric acid, and changes in pH within the air can influence asthma exacerbations as well, and may serve as a respiratory irritant. And again, the formation of ozone through the NOx, the nitrogen oxides with the VOCs. Now here's some good news for Allegheny County. We've not been out of attainment for nitrogen oxides ever, and that's been measured at the Lawrenceville Monitor. Again, thanks to the Allegheny County Health Department for the graphs. Sulfur dioxide is actually a different story in that we do have some of the highest values in the nation for sulfur dioxide. It also forms sulfuric acid as a secondary pollutant, and particularly regionally, we're very vulnerable to spikes because of our regional industry. We do have some of the highest levels in the nation. The air quality standards for sulfur dioxide allows for short-term peak exposures, and people with asthma may be susceptible to asthma exacerbations associated with these peak exposure levels. As I mentioned, sulfur dioxide primarily comes from fossil fuel combustion and electric utilities and other industrial facilities. And the gradient of sulfur dioxide is basically west to east, with the highest concentrations occurring here. And EPA specifically cites the Pittsburgh and Steubenville, Ohio areas as the very highest in the nation. with an annual average SO2 concentration I apologize, the 1 hour maximum concentration reached 0.013, and the actual maximum value is about 0.7. So it's really off of this chart. But again, that was just a very transient exposure. But still, asthmatics may be susceptible to that. However, the big player in this area is particulate matter. Several studies have documented increased respiratory symptoms and increased hospitalizations for acute respiratory illness associated with particulate matter exposures. Decreased peak flow has been observed in panels of normal and asthmatic children when they're exposed to particulate matter. In addition, traffic pollution, which appears to be bad here in Pittsburgh to all of us who drive it every day, but is not really some of the worst in the nation. There are increased respiratory symptoms in children who are shown to live, we do proximity analyses for a lot of these things, near roadways with high traffic density. Several studies have shown that this is actually due to the nitrogen dioxide that's emitted in the traffic, and this has been the single pollutant shown to be associated with those asthma exacerbations. In addition, there's diesel particulate matter and black carbon. So this is not necessarily traffic pollution that we're looking at here. This is the Liberty Tunnels in 1954 and then 1965. So after things got cleaned up a little bit around here. As I mentioned, particulate matter really has been the worst aspect of the Pittsburgh air pollution. Seventh in short-term particle pollution. This is down from number 2, worst in the nation, just this year. This was recently announced. Although we have decreased over time, we have not decreased as quickly as some of the United States cities has, and I think that has lent to our being ranked very high as time has gone on. So now to switch gears a little bit, this is a Sentinel study conducted in Pittsburgh in 1978 in the American Journal of Epidemiology. They noted, this is Stebbings from 1978, who did pulmonary function tests on 224 school children during and after a air pollution event here in Pittsburgh in 1975. He chose 4 exposed and 2 control schools, some children with asthma and some children without asthma. And he was able to note an increase in forced vital capacity after the episode. So the children did have a decrease in their vital capacity during the episode. Now, interestingly, the children with asthma were not able to recover within his time frame. Next, more recent studies of the epidemiology of asthma and air pollution. This is what we call a time series study that was published in 1994, but largely measured hospital admissions for asthma and respiratory illnesses in Montreal, Canada. These admissions had occurred between 1984 and 1988. This is data from 31 hospitals, and he evaluated 1 and 8 hour maximum ozone controlling for the day of the week, which is actually very important because when you're going to the hospital, there's a slight greater likelihood that you're going to go on a Saturday or Sunday because Monday through Friday you can get to your regular doctor's office. So you really have to do epidemiologically control for some of these factors. And in addition to that, it's important to note that it's not always necessarily the day that you're having the event that you measure the air pollution. You want to take a look back at a couple of days before that. We call those lag days. And I just wanted to introduce this term because I'll be talking about it as I talk about the study that we did here in Pittsburgh. So we generally look at 1 or 2 days, especially with hospitalizations, because the air pollution gets bad and you start feeling bad. But it may, it sort of has an effect that gets worse over time until you finally get to the hospital. So not only do you have the effect where you start feeling worse and worse, and then you have that, oh, do I really want to go to the hospital kind of effect, and then you might go the next day and even be recorded there overnight. The Delfino study, published in 1994, found effects for ozone pollution particulate matter, and SO4 pollution. That indicated that there were about almost 10% higher when the SO4 had exceeded a particular threshold, and that was 4 days prior to the admission. And as we can see again, the older individuals were more susceptible. I don't believe that they specifically took a look at children within this study. Next is also a fairly recent effort, and this was a Sentinel case crossover study, and this took a look at emergency department visits as opposed to the hospitalizations, as I had discussed in the last study. Again, all pollutants had an effect on ED visits, including SO2, NO2, carbon monoxide, and both particulate matters. Children aged 2 to 4 and the elderly were most affected, and those are odds ratios, which means that you're almost 50% more likely to go to the hospital on a day when the pollution is higher, or 2 days after that pollution gets higher. So the case crossover analysis, I'll actually discuss because that's the same type of analysis we did. Now this is a paper that was just published last month in the American Journal of Public Health. They took a look at hospital admissions in California by zip code between 2000 and 2005. So we can remember that air pollution has been getting better, but we still are seeing these effects on hospital admissions, on emergency department visits. The title of this study was The Influence of Socioeconomic Markers on the Association between Particulate Matter and Hospital Admissions. This region, importantly, is also not in attainment with current EPA standards. One thing that they tried to look at was socioeconomic status. We remember that in Pennsylvania and in Allegheny County, the African Americans within our population were having much worse outcomes, had a much higher prevalence of asthma. Often we find that African Americans within the population as a whole have a different socioeconomic status. Now they found in this California study that the people of lower socioeconomic status, they took a look at zip codes. They went to the hospital more for asthma, but they were not more influenced by the air pollution. So that was a particularly interesting and very recent finding. Now here within Allegheny County, as I mentioned, the monitor in Harrison, and this is PM 2.5. So we can see that down in through our Monongahela Valley, historically the area with the most industry and the most air pollution. We also have a little pocket over here next to an industrial site along the river. Now Harrison Township was where the highest ozone levels were, and here's where the pockets of particulate matter are. And in a cluster analysis that we did, we were able to show that ozone was highest in the county borders and that the particulate matter was indeed highest in that area. And these are the excursions noted within the 2011 Allegheny County Health Department annual report for air quality. And we can see one thing of note is certainly sulfur dioxide hit a maximum of 450 parts per billion, and the standard is 75. But there's a number of other excursions for ozone and particulate matter that occur throughout the year. Here's a little comic relief. This is Dr. Talbot and I at a Penn Future rally that was held, I believe, in Shenley Park, talking about the effect of pollution on asthma. And I put this slide up there to talk about the fact that what we try to do is translate the research that we do on air pollution and health effects to inform activist organizations and to, in addition, help affect policy change that we can see through EPA and the standards being lowered, so it improves our public health. This is an article that we published last year. I'd like to thank my co-authors, Dr. Joanne Glad, Dr. Evelyn Talbot, Dr. Pei-Chen Lee, Dr. Xiaoyi Zhu, and Ms. Melissa Saul and Ms. Judy Rager, some of whom are in the audience today, and thank you very much. This was using data from the UPMC hospitals to assess the relationship of ambient ozone and PM 2.5 levels on emergency department visits. and to assess the possible influence of gender and ethnicity here in Allegheny County. We looked at 6,979 patients seen in 6 emergency departments between January of 2002 and December of 2005 who received a final diagnosis, discharge diagnosis of asthma. The air pollution data that we used came from the Allegheny County Health Department Air Quality Program. We used 3 ozone monitors and the 2 operating PM 2.5 monitors. We ended up using one in the center of the city, the Lawrenceville monitor near the hospitals of interest. We used 1-hour maximum ozone levels and daily mean PM 2.5 levels, as well as controlling for daily mean temperature and humidity, which can also affect asthma exacerbations. Our study population, of the almost 7,000 visits, there were over 60% Caucasian. Their mean age was 42 years. There were almost 38% African Americans, and their mean age was 35 years. And you can see in the distribution, only 7 to 8% of the African Americans were over age 75, where almost 18% of the Caucasians were. And also the children were slightly more represented among the African American population than the Caucasian population. Now, we took a look at all the visits, but we did have a unique identifier that we were able to tell how many times a person went in over this 6-year period. And that ranged from 1 visit to 19 visits per person. And African Americans had a slightly more number of average visits, about 1.6, as compared to Caucasians who had about 1.3. We used the case crossover design. This is a design that's been around since the early 90s. It was designed to avoid selection bias in a case control study. When we take a look at a lot of things, we say, okay, we have somebody with asthma, we have somebody without asthma. What makes them different? Which is fantastic, except for the fact that there are genetic differences. There are differences in history and exposure to viruses and in many, many other things when you take a case and a control. So what we do is we take different days instead of different people. So we sort of have a baseline. We know that basically the burden of virus in a population remains steady. We know that all the other factors, day of the week, seasonality, which changes the pollutants of interest at that given time. Those things all stay the same. We take the cases and we do a crossover when there are cases and when there are controls, and that's based upon day of week. And people can cross over between short periods of exposure, and then we can assess the triggers for these acute outcomes, including asthma. We match these by day of the week and season. Referent times act as the individually matched controls, and you match one hazard period to a referent period. And this is several examples of how we can do that. Say if the asthma exacerbation occurs on the 7th here, then we take these 3 days. So we look at the pollution on this day and the couple of lag days up to it, and we say, wow, was that a whole lot higher than these 3 days here? Same, we can do it with days before, and we can do it with days after. But the idea is to match on day of the week and season so that you're not taking a day in December and you're not taking a day in June and trying to compare apples and oranges. The case crossover design controls for measured and unmeasured confounders that don't change over time, such as age, gender, and the genetic makeup of that individual person, and just looks at the influence over time of what air pollution does to them. So our results. We can see that within the total population, we found a significant effect 2 days before the event for ozone exposure. Same for the total population with particulate matter exposure. They were 2.5% more likely to head to the hospital when the ozone 2 days before they went was high, based upon the paradigm that I showed you earlier. The same was true for the African American proportion of the population. I apologize, that didn't include the ozone exacerbation, but they were very susceptible to the influence of particulate matter 1 day, 2 days, and 3 days before the emergency department event, as well as the accumulation of having a high particulate matter exposure during the week before that event. Unfortunately, we didn't have Children's Hospital data available for this analysis, so there are only about 3,000 children represented in this analysis. We found that within the total population, a 10 parts per billion increase in the 1-hour daily maximum ozone level was significantly related to a 2.5% increase in asthma visits 2 days later. When taking a look at PM 2.5 and ozone together, we found a 2.1% increase of asthma 2 days after the exposure. 1 day after a PM 2.5 exposure, a 3.6% increase in asthma ED visits occurred. Although the entire population were affected 2 days after a particulate matter pollution event, this effect was not significant among Caucasians. It was slightly stronger among the African American population, which appeared to drive the overall effect. There are possible reasons for the racial differences within Allegheny County, which include access to medical care, access to air conditioning, intrinsic genetic differences among the types of populations, and the different distributions of air pollutants that I'd mentioned before within the county. We used ED visits, which are found to provide a strong and a very specific outcome measure, slightly stronger than hospitalizations because someone's much more likely to go to the emergency department than actually get admitted to the hospital. We use the case crossover analysis, which we like because it allows to control for seasonality, secular trends, and time invariant factors of that person. However, we use just one single monitor within the middle of Allegheny County to estimate exposure. And we realized that the sample of emergency department visits that we used may not be representative of all emergency department visits. We do have a couple other projects that we're working at, and I'll go over those very quickly. This is current and future work. One is a time series study that we're doing within the Pennsylvania Department of Health, and we are using the asthma surveillance model at the Allegheny County Health Department that I'd set up during my time there that Dr. Gentile had mentioned, and we are analyzing daily time series for asthma, circulatory, and respiratory counts for 2004 to 2005. Our preliminary results indicate that asthma hospitalizations were increased when PM 2.5 was increased on that very day. In addition to that, we are working with the Pittsburgh Aerosol Research Inhalation Epidemiological Study, in which we utilize the surveillance system at the County Health Department to get a more refined estimate of air pollution at a person's residence. Now that's de-identified through the Health Department, and we just do that on an aggregate basis. So we're very happy about that, and to continue this work in total. And you know, the conclusion is that recent studies conducted in Pittsburgh indicate that there's an effect of ozone and particulate matter on asthma exacerbations. Thank you.